Yeah, thank you, Professor Wiestler, for this kind introduction. Your Excellencies, ladies and gentlemen, it is an honor for me to address you today as you're gathering here to collectively shape the future of healthcare. And indeed, over the past couple of years, you have probably gotten used to a certain extent to representatives from IT companies addressing you here. Today, we are indeed going one step further. With me, you have the Chief Financial Officer of an IT company talking to you, and that may at first glance feel strange. But since I'm not only responsible for the corporate finance affairs of SAP, but also deeply involved in our corporate innovation processes, I feel actually encouraged to lay out in front of you a few perspectives from my own stance that maybe can help in the discussions around the healthcare of the future. So that matter definitely is of high interest to the Executive Board. Professor Wiestler has said it of SAP. We have recently decided to materially step up our efforts and investments into healthcare, partnering with leading medical institutions. We do this because the value that can be generated by investing in this most human of sectors and by applying our technology platforms is indeed enormous. And I definitely mean value way beyond the mere financial aspects. What unites us here is the shared purpose of improving the quality and accessibility of healthcare. And yes, the potential for healthcare supported by IT is huge, but it is also true that in order to exploit it requires some disruptive changes. In essence, the business and engagement models in healthcare need to be discussed. But before going too far into this, let me recapitulate briefly how the IT industry has in the past been relevant to healthcare. For quite some time already, providers of business software have helped healthcare institutions of all sizes around the globe run their business operations. However, beyond this focus on operations over the past decade, two major trends have emerged in IT, actually across the globe and all industries, and those are data analytics and networked solutions. In short, today's technology turns big data into smart data, that is, into insight that can drive decisions, most notably the decisions of researchers and physicians. 44 zettabytes of data are estimated to have been generated by the year 2020, and actually 30% of the world's data today is healthcare related. I know we all agree that it does not matter how impressive the data universe is. What counts is that we can derive value from it, insight that informs medical decisions or advances research. By analyzing really large data sets, it becomes possible to see patterns in treatment and response that enable us to develop more personalized diagnosis and courses of treatment. Being able to slice and dice locally available data in real time is a big accelerator in healthcare. The other one, and maybe even bigger one, is sharing those data across networks. And that is exactly what the projects that SAP is driving together with numerous renowned institutions are about. Let me share a few concrete examples. The first two actually relate to the fight against cancer. In partnership with the German National Center for Tumor Diseases, the NCT in Heidelberg, we have developed the so-called Medical Research Insight solution. It enables physicians and researchers to securely analyze clinical data from various sources so as to accelerate medical research and to facilitate the process of matching patients with the best treatment options in clinical trials. What is so impressive to me is that with a number of clicks across data, with this solution we can achieve the insights that in the past would have taken an entire doctoral thesis. I had mentioned that the analysis of data is one thing, but the potential increases dramatically if you are doing this in a networked environment. Here's another cancer-related example that highlights in particular the network aspect. In January, ASCO, the American Society of Clinical Oncology, and SAP announced that we will collaborate to develop CancerLink, ASCO's health information technology platform. This platform is designed to bring together real-world patient care data from millions of electronic health records to deliver personalized care to people with cancer and cancer survivors. When complete, CancerLink is expected to enable securely processing and analyzing data to provide immediate feedback and clinical decision support to providers all across the United States. For the time being, we plan to deliver a first version of CancerLink in late 2015 with patient records from 16 oncology practices, which covers already 500,000 patients. Let me continue with another project that also leverages the potential of networks toward personalized medicine. Our friends from pharmaceutical and diagnostics company Roche created a preventative program called AccuCheck View, which is designed to avoid or at least delay diabetes for the 6 to 8 million Germans that are diagnosed with it. For this program, we developed the so-called HealthLink solution, consisting of a mobile application for patients and a cloud-based portal for physicians. By sharing medical data, like, for example, the blood glucose levels, blood pressure, weight, etc., the physician can coach the patient on their journey to lifestyle change and instantaneously react on risk conditions like a too high fasting blood glucose level. The solution stores, processes, and shares health data from mobile devices and thereby enables physicians to see data per patient and to make more informed decisions regarding therapy. For the pharma company, obviously having such data available in anonymized fashions enables new business models geared towards health outcomes. An app-based communication is also at the center of the Medical All-Round Care Service Solutions project, also called MAX, to be conducted together with our colleagues at Charité and numerous other distinguished partners. It aims to provide integrated care for chronic kidney disease patients in a networked environment and brings together data from hospitals, cyber-physical systems, and mobile applications on a secure platform. It has recently been selected as one of the projects to receive funding from the technology program Smart Service World that is aligned with the digital agenda and high-tech strategy of the German federal government. Ladies and gentlemen, these were only a handful of stories that data analytics and networks are writing across the globe today in healthcare. The potential is indeed enormous, and the revolution is within reach from a technical standpoint, but there are numerous aspects still to be figured out. I'm convinced that the new medicine enabled by network data analysis technology can unleash its power only if we generate the right business and regulatory framework. We need to look at the bigger picture of how healthcare is run. And being a CFO, no wonder that I will start with the aspect of efficiency first. Efficiency is a major challenge in how we run healthcare nationally and globally these days. Worldwide spending on healthcare is growing steadily. And let's be clear, spending a lot on healthcare isn't necessarily a bad thing. Actually, it's hard to imagine a better cause to spend money. The problem is that we are spending a lot, but could get much better outcomes when it comes to caring, curing, and preventing. Even though healthcare is one of the largest industries in the world, it is still characterized by immense fragmentation and very little standardization. In practice, that leads to enormous variation both in cost and quality of care, and rarely brings about a good ratio between the two. So the healthcare sector needs to align itself across the various stakeholders so that it generates maximum value for the patient, drives research while at the same time providing the right incentives for the economic interests of the involved stakeholders. But things indeed are starting to change. In many industries, the trend is towards producing products and services custom-fitted to the needs of the individuals. And in healthcare, we see the potential for a similar revolution toward treatments personalized per individual human being. Analysis of both personal and cohort data can indeed help generate insights that have a manifold value in increasing the quality of healthcare for the recipient. In parallel to quality going up, cost has the potential to go down, because networked big data analysis can facilitate the time to accurate diagnosis, time to application of an adequate therapy, and the time to being cured are going to be reduced. But we need a significant transformation of the healthcare sector on the national levels and internationally for unleashing that potential. I believe we need to collectively invest time and effort into discussing new holistic models for healthcare. This is a huge effort, and science, medical professionals, politics, and the industry need to collaborate to make this work, in some aspects even across borders. There is yet another completely different topic that requires work, the question how to deal with data. It touches not only technical and economic, but also legal, emotional, and of course ethical categories. However complex it may be, we need to answer these questions too to really get to the next level of healthcare. One issue is that of standardization. Today, biological data, clinical data, and lifestyle data are basically separated into disparate systems. We need to work on integration, harmonization, and simplification when it comes to collecting, exchanging, and analyzing this data in a meaningful way. The data formats themselves need to be standardized as much as possible. And we need the infrastructure to exchange data across secure networks designed for healthcare scenarios. Doing this requires a joint effort between medical, technical, and regulatory experts. The good news is that technically we already have platforms that are designed to enable this integration, but a hurdle is the often undifferentiated discussion regarding data privacy and security. There clearly is the conflicting interest of, on the one hand, preventing the abuse of data, and on the other hand, using network data in order to derive insight that benefits all patients. But access to and exchange of data is the key to a more effective and efficient healthcare system. Clearly, data privacy and security is a matter of providing the required secure technology. I don't want to downplay that at all. But it is also a question of the concerned individuals or society agreeing to a certain level of data flow and exchange. Any regulation in this context should be based on a clear understanding of the risks and the opportunities involved. We need to safeguard patients from the abuse of data, but no data exchange at all can also not be the right answer. The right data can prevent the wrong diagnosis and the wrong therapy. The lack of specific and statistical patient data is a huge cost factor in the healthcare system. This is to a large degree a communications job to be done in many societies, a job for opinion makers in the political discourse, but also for all other players in the healthcare and public prevention sector. Both when it comes to standardization and data privacy and security, we need a regulation across Europe that prevents us from limiting the potential advances in research to national silos. So please let us collectively figure out the missing pieces regarding standardization and the acceptance of secure data exchanges. It takes new thinking, open to new models, and many different stakeholders to make this happen. And one of these stakeholders are indeed the corporations who have an essential interest in supporting the health and well-being of their people, of their employees. That is what I would like to touch on briefly in the last part of my remarks, because I believe companies need to take more responsibility for and dedicate themselves more to the health of their employees. Part of that dedication needs to include ways to provide employees with innovative analysis and treatment options to support their health. And to cite an example which also closes the loop to the cancer-related projects that I covered at the beginning, SAP recently announced a partnership with the biomedical company Molecular Health to introduce the so-called Corporate Oncology Program for Employees, or in short, COPE. It generates a treatment map that helps physicians make better, faster, and safer cancer treatment decisions. It gives physicians an understanding of how a patient's genetic profile and personal medical history can impact the progression and treatment of cancer, and personalized treatment is made possible by genetic sequencing and an ultra-fast alignment algorithm, which is powered by our own in-memory software, SAP HANA. The COPE program has been running for 1 year now, of course on a voluntary basis, at no cost and available to our employees, and ensuring the highest standards of data protection. We are proud to be the first company in the world to make this service available for our employees that have been diagnosed with cancer. So for companies to care for the health of their employees is a value in itself, but in addition there are even strong positive commercial and economic effects when companies engage in such practices. At SAP we have for the 3rd year in a row now integrated our annual financial reporting with the reporting of what we refer to as our Business Health Culture Index. This is a score for the general cultural conditions in our organization that enable employees to stay healthy and balanced. The index is calculated based on our regular employee surveys. And what we found was hard data showing that actually an integrated strategy not only enhances the well-being of our employees, but also boosts our business success. A change by 1 percentage point only of our Business Health Culture Index would actually have an impact of between 65 and 75 million euros on our operating profit, just through the prevention or decline of absenteeism and presenteeism issues. So in closing, I believe the new healthcare driven by the convergence of IT and medical expertise has the potential to develop at high speed with the patient's well-being in focus as our final destination. What we are seeing today already is astounding. I would like to compare this wave of disruptive innovations to a modern high-speed energy-saving train headed toward a patient-centric future. We are doing well in building it itself. However, we need to lay the adequate fast tracks for it so that it can really zoom forward. Today it is leaving the station too slowly because the existing tracks are holding it back, most notably the existing business models and regulatory environment. and to some degree also the attitudes around the significance and utilization of data. The good news is, though, we are headed in the right direction. Ladies and gentlemen, thank you very much for listening to my perspectives. Thank you.